course, is also part of the host of this program. Let me acknowledge a lot of support that we had from country teams, global networks like TB People, GCTA, also helping to coordinate their country members to support in this process. So let me start by saying thank you to Sarah. I mean, this Sarah Middleton, I'm sure she may be on this call. She was one of the, she's the lead writer and one of the very instrumental people who were very instrumental in making sure that this report actually happens. Deadly divide, yes, a really deadly divide. Is a very strong statement coming from civil society. This is actually community-led process, a deadly divide between commitments and realities. So today we are going to be having the first lunch, but we're going to be having other regional lunch, coming up from other continents as a whole. So it's something that we are looking forward to also joining other people in their own lunch as it happens. We are very happy to have very key people who are very passionate about the fight against tuberculosis and these related diseases on the program. Today we'll be listening to Olive, who was also the regional focal person for this report for Africa. Sarah Middleton, like I said, is the lead writer. We thank you so much for helping in a very short time, with all the challenges that we had, and you also had putting this report together. We are so happy. Our regional focal persons, especially our own Africa regional person, Olive Mumba, who also will be speaking on this program, this event. We'll also be listening to Luchika to make a few interventions after Olive speaks at this program. We'll be listening to Honorable Stephen Mole, Member of Parliament from Kenya, who is also the chair of the Africa TB Parliamentary TB Caucus. We'll be hearing from Bebeku, a celebrity from Uganda, my friend. Also from RMD, Richard Mofe Damijo, from Nigeria, my mom's favorite actor. So without delaying, I will start by saying that this report is a community-led report. Everything about the report is community-led, but we have very strong voice coming from all the civil society and other sectors as well, public sector. And so it's something that when you listen to Olive describe the report, it's something that that really, took a longer approach in terms of extended consultation happening around it. We're also going to, at the moment, before I start, I will start by asking Ricardo to actually play a short animation about the Hello Kitty, so that we can move on. So thank you very much, Ricardo. This is a new initiative, a collaboration between the Stop TB Partnership and Japan government. It's something that, often we find it very difficult and hard to, to reach children. Our interventions are always focused on adult and adolescents. Children are usually neglected in terms of our communication strategy. But I think this is something that will resonate with children. So let me start by introducing Olive, who is from INASO in Tanzania, and also a member of Africa Coalition on TB ACT, and they're also a representative of the Stop TB Partnership Developing Country NGO delegation. She is, like I mentioned earlier, she is the regional focal point for the Deadly Divide. She will be making a presentation, which is actually popping up already on the screen, on the Deadly Divide. Olive, please go on. You have the floor.
Thank you very much, Austin. I hope you can hear me.
We can hear you. Please go on.
Thank you so much. I'll be talking and I'll be presenting this report titled A Deadly Divide, TB Commitments versus TB Realities. This report is a community's perspective report on the progress towards the UN political declaration on the fight against TB, and it also has a call to action to close the gaps in TB targets. I am speaking on behalf of the Stop TB affected community and NGO delegations, and the team is also part of this conversation. Yes, so the purpose of the community's report, it does the following. It gives a voice to those most directly affected by TB. These are people who have often been left behind, and it is the first for the TB community. And as we all know that the TB UNHLM report came out earlier this year. So this is more of a community's perspective report. It provides a progress report of the pivotal role played by communities, civil society in following up and monitoring the implementation of the political declaration and holding stakeholders to account. But it is also part of the global community's accountability process, where we also want to see what is happening and also look at what we want to happen in the coming years. It also aims to complement the 2020 UN Secretary General's Progress Report by providing an alternative and complementary view. Instead of just the numbers, we also look at the qualitative aspect. It also provides a status update on the declaration's targets and commitments through the lens of affected communities and civil society. It is a very interesting report, and I hope we are all geared to listening to it. The community's participation and developing report. This report was developed by 150 civil society and affected community partners, provided input. What we did is we had surveys, forms were sent out, they were filled, and then the written submissions were provided. And as Austin mentioned, Sarah Middleton-Lee and later on Lynette also supported in terms of analyzing and developing the shadow report. It was a thorough report where we also had case studies from so many other TB implementing partners. And I hope that we'll be able to really learn a lot as we will see the richness in the report itself. It covers 60 countries, covering Asia Pacific, Anglophone, Francophone, Lusophone Africa, the Americas, Eastern Europe, Central Asia, Middle East, and Northern Africa, and as well as donor countries. In terms of the report itself, it has a component of introduction, providing the background, the purpose, and the methodology that was utilized. It provides us with progress towards the political declaration. It highlights 6 areas. I think we'll go into those later. And then after that, it also goes into the call to action, and it has some annex. In terms of the 6 areas for action, which were identified by the community, civil society, we can see that there were 5. There are 6. 5 of them were developed during the UNHLM, TB UNHLM process. But the 6th one, we all know that this year has been a very interesting year, because of COVID. So in terms of the areas, I would first of all like just to read through them so that we get to know what they really are. The first one was reaching all people through TB detection, diagnosis, treatment, care, and prevention. The second is around making TB responses rights-based, equitable, and stigma-free with communities at the center. The third one is accelerating the development of and access to essential new tools to end TB. The fourth one is around funding, investing the funds necessary to end TB. The fifth one is around committing to accountability, multi-sectorality, and leadership on TB. And the sixth one is leveraging COVID-19 as a strategic opportunity to end TB. In terms of the content under the areas for action, it provides progress or a snapshot of milestones under each of the areas for action, and which focuses on these 4 key areas. First is the commitments or the targets as the political declarations. It also provides milestones as per the 2020 UN Secretary General Progress Report. And it also reported challenges and barriers, both being systematic or otherwise. And it also documented case studies of communities' actions and responses. It also acts as a check for targets that it compares the targets that were set and the reality that is on the ground. It also provides reference from the UN Secretary General's Progress Report, which was produced by WHO in September of this year. As I mentioned, that we got case studies from various implementers, including other Stop TB Partnership and other donors. I would like to specifically mention TB Reach, where we also got some examples from Africa and also from Asia. But here we have 2 case studies. One is around coming from identifying TB key and vulnerable populations in Asia Pacific. And then I will not go into reading it, but as when you get it, I would encourage everyone to read this report. It is worth reading. Each and every page, it is worth reading. The second case study is around reducing drug-resistant TB among people in prison in Azerbaijan. Yes, I got it right this time round. Yeah. So it provides us with 25 solid community case studies, which show the value added of community engagement and their efforts to fill the systematic and programmatic gaps. These provide a case for increasing investment in affected communities and civil society. And it is a point that I need to mention that we have seen a lot of change through the community engagement, and thanks to Stop TB Partnership and to Luchika and the team specifically. Now, key messages from the report, there has been important advances by governments and member states in all areas of action. In 2018 to 2020, which is the year under review, progress has been there, but it is too little and it is too slow. We all know the number of new infections or new number of infections per day. So we need to catch up with that speed. With a deadly divide between commitments and results hitting hardest at key and vulnerable communities. Do we know our key and vulnerable communities in the contexts where we live in? That's a key question I would want to ask you all. The role, engagement, and funding of TB affected communities and civil society is essential to the scale and quality of policies and programs needed, and reinforcement of people-centered TB response. We've also seen the introduction and scale up of community rights and gender initiatives are shaping national and TB strategies and the trajectory of the epidemic for the better. We've seen the challenge facility. We've seen how Stop TB Partnership is working, especially in the priority countries around the assessments, the CRG assessments. And we also I want to thank the CRG team within the Stop TB Partnership, but also those that fund the challenge facility, including USAID. Accountability for the response to TB remains weak, with multi-sectoral and high-level leadership often inadequate. These are some of the key areas we need to invest in. Funding for TB is inadequate. Donors and multilaterals need to increase investments in the response in affected communities and civil society, in research and development, and in market expansion for new tools. COVID-19 has disrupted everything, but it is an opportunity. And we've seen that it is reversing the gains made in the response to TB. How can we make it an opportunity to build back better? Now, I want us to just reflect a bit. Having gone through the UNHLM targets, having gone through what came out from the communities, now we strongly have a call to action from the communities and civil society, and we issue this call to action to demand social justice in the response to TB, a disease that is preventable and curable. Yet it takes the lives of close to 4,000 people, including 700 children every single day, every single day. We want to ensure that TB-affected communities and civil society have a voice, that our realities and our priorities are understood, that lives are saved. And when we talk about these numbers, we're talking about people behind those numbers. In terms of calls to action, we call upon UN member states to take action. First of all, to reach all people through TB prevention, diagnosis, treatment, and care. And this is by setting ambitious and time-bound national targets for TB to meet the commitments of the political declaration, and by operationalizing them through aligned national TB strategies, implementation plans, budgets, and monitoring evaluation frameworks. The second call to action is to make the TB response rights-based, equitable, stigma-free, with communities at the center. I cannot stop but just to repeat: rights-based, equitable, stigma-free, with communities at the center. Every high TB burden country before the end of 2022 completing a TB community rights and gender assessment, a TB stigma assessment, followed by the development, funding, monitoring and evaluation of a national community rights and gender action plan, and a stigma reduction strategy. The third call to action is to accelerate the development of and access to essential new tools to end TB. We've sung this song for too long. It's time to take action. I will not go through, because we have and we know when we talk about essential new tools to end TB, and I want to stress that one. The fourth one is to invest the funds necessary to end TB. And this is by collaborating to achieve 100% of the political declaration's targets for financial investments in the response to TB, and the scaling up of domestic and international funding from community-based and led TB intervention. I would like to, as part of ACT, we have a campaign which is calling upon 33% of funds from Global Fund to be invested in TB. The fifth call to action is to commit to accountability, multi-sectorality, and leadership on TB. These are the backbone. We can talk as civil society, we can go on the road, but if we don't have accountability, if we do not have multi-sectorality and leadership. I'm happy that Honorable Mule is here, because he, I know, is going to talk more around that area. In terms of call to action number 6 is leverage COVID-19 as a strategic opportunity to end TB. And this is by developing, funding, and implementing TB COVID catch-up plans to enable national TB programs to get back on track and accelerate towards the political declaration's commitment, with COVID-19 framed not as an excuse to fail to meet TB targets, but as an opportunity to build back better. How to use COVID to respond to TB. So those were the 6 call to actions, and even examples of what we want to do, the recommendations of what we want to have to take place. In terms of the next steps, there are several steps. You, everyone that is here, yes, you who is listening, that you can take. First of all is to share this report with your country partners, possibly hosting a national launch event, Let us know through ACT. Let us know through your Stop TB delegates, that a delegation that they can support this. Please download the advocacy toolkit and use this for various areas. You can use it to share in terms of your social media accounts. You can send a letter to donor embassies in your countries. You can send letters to political leaders in your countries. You can send a press release from your organization. And yes, you can do so many much more. Let us know. And that there is the link to where all those templates are. And note that advocacy toolkit will also be available in French, Spanish, Russian, Portuguese, and Arabic. With that, I would like to thank you so much for listening to me, but also giving me this opportunity to share this report, because I know there were so many people who took part in bringing this report to where it is. I want to also thank Stop TB Partnership for providing us with this opportunity to have a community's perspective report. I hand over back to you, Austin. Thank you so much.
Thank you, Oli, for that wonderful presentation. I forgot to inform the participants that if you have any question, please use the same chat platform that you're using to introduce yourself to have the questions. We'll be answering your questions as we move on with the event. Please make sure you use the chat section for your questions and answer. Thank you so much again, Olive, for that wonderful presentation. I know it may not be comprehensive because the report is so good that you need to take your time to read through. There's other sub points coming from the call to action, a lot of other points coming out of it. So when you get the report, I'm sure you'll have time to be able to look through the reports. Let me also not forget that to inform the participants that this process was actually led by the three civil society delegations on the Stop TB Partnership Board. Thanks to Timur, thanks to Aaron and Toko as well. Thanks to James from the Stop TB Partnership, because we had a very strong support from the Stop TB Partnership and the team. And on that note, let me also use the opportunity to call on Luchika Ditu, the Executive Director of the Stop TB Partnership, to respond to Oli's presentation and to suggest how we can work together to implement the call to action. Thank you, Luchika. Luchika, yeah?
Austin, I think Ruchika is not able to speak.
Okay.
But I am available in case she's not able to speak.
So Sahu, if you can you respond? Thank you, Sahu. Thank you so much. I think I got that message earlier because I saw her name on the list of participants. Sahu, if you can actually reflect on Olive's presentation and also suggest how we can work together to implement the call to action. Thank you.
Thank you, Austin. And Ruchika is currently taking care of a health issue with a family member, so probably in the hospital somewhere. But just a few words on behalf of Stop TB Partnership and what probably Ruchika would have said. So first of all, a big congratulations for the launch of this report. Hugely important report, enormous amount of work that has gone into it, and the findings and the call to action, which are great, bold, and should drive our future actions in that direction. So this community-led Deadly Divide report is the first of its kind, as people said, but wanted to just highlight that this is the first of its kind in the TB response. We have seen that in HIV and in other responses, but not in TB. So that is great. And this is actually a historic report. This is a historic report, first of its kind. So we have to realize that and And with that, we want to thank all of the people who led the development of this report, which is community-led. And you heard about the number of organizations involved, the diverse kind of feedback, case studies, and everything that was done for the report. So this is an excellent voice of the affected community for TB, which we were missing in the past. We had different kinds of monitoring reports, monitoring of commitments, accountability, but that the voice, united voice of the TB affected community in a strong way put in a report like this was missing, and this is great. And that's why this is a historic report, and that's how we are trying to call this. As you saw, thanks Olive for presenting this, the findings very sobering, highlighting the divide, the deadly divide between the commitments and the realities. And this is you can imagine a picture in your mind. This can be applied to many things, many small things that happen to construct the whole TB response. So this divide is very important, and thanks for highlighting that. As you saw, progress too little, too slow compared to the commitments. The call to actions very bold, all 6 of them. And now we expect that this will lead to advocacy and investment and action. And anything that Stop TB can do in our capacity to support a community-led action on these 6 areas, we will do our best to support. And we want to again thank all the people that were behind this. And we must ensure that this report is not just one-off, but this is the beginning of many more reports that should come as affected community perspectives on TB. So thank you all, and congratulations to all who led the development of the report, and also those who contributed in the report. Thank you.
Thank you, Sahu, and our prayers to Luchika as well as she go through whatever health condition it is. Our prayers with her. First of all, let me also remind you that, as Sahu said, there are practical steps in the how to implement the call to action. It's right in the report. So when you get the full report, you see there are practical steps on how to implement the call to action in the report, and that is also good. Thank you so much, Sahu, for that good intervention. I want to call on Honorable Mutinda Mule, MP from Kenya. He is the chair of the African TB Caucus from Kenya. I want him to reflect on the report as well, and also to suggest how civil society and MPs can work together to implement the 6 calls to action. I'm sure, because I'm sure he joined. Honorable Mule, please, you have the floor. I give you 5 minutes to just make that intervention. Thank you.
Hi, Austin. I think the Honourable Mule just dropped. I'm not sure, but I think I know that some of his colleagues from the TB caucus, including Pedamoyo, are online. So I'm not sure if they wanted to say a few things on.
Maybe Pedamoyo can say something.
Okay. Good day, everyone. I'm Pedamoyo Magaya, standing in for Honourable Mule. Unfortunately, he had to be called to Parliament to meet with the Minister of Health. He was hoping you would make it for the meeting, but he has just sent his apology, but he also sent a message for me to share with the colleagues here to say congratulations on the launch of the report, and he's happy on the board call to action points that have been presented, as these are going to map our future work in the TB response. And also for me to share with him that as members of the Global TB Caucus, we have been involved in development of this report, and it is now 2 years from the high-level meeting on TB, and we still realize that there's a major gap between the targets endorsed by heads of state and government and the results achieved. So we are hoping that as the Global TB Caucus, we can continue working with the civil society to ensure that the targets for the high-level meeting are achieved. The Global TB Caucus is a network of members of parliament in 152 countries with more than 2,500 MPs who are at the disposal of civil society. We are here to advocate for any policies. We are here to advocate for any practices that you need changed in the TB response. And particularly as the Global TB Caucus, we commit and we reaffirm our commitment to the targets agreed in the political declaration from the UN high-level meeting on TB. As now more than ever, we need to strengthen international ties and work together in order to ensure a holistic, financed, and sustained response to TB. We continue to work with our governments to ensure adequate financing is made available to safeguard the progress made in the response to TB at the national, regional, and global levels, as well as honoring their pledges to the Global Fund to fight AIDS, TB, and malaria, which is responsible for a sustainable financing of the three diseases in many high-burden countries, whilst also investing in pandemic preparedness and the strengthening of health systems. We also want to commit to continue involving our national TB networks of people affected by TB and its meaningful engagement in aspects of the governance of the national response to TB. So as the Global TB Caucus, we are at your disposal. We are here to make sure that the calls to action are fulfilled. Reach out to us, reach out to the MPs in your areas. Let's put TB on the agenda. Let's get the 33% that we're advocating for. Thank you. Your message from Honorable Mulu.
Thank you, Padaima. Thank you, Honorable Mule, for sending that wonderful message to us. We are entering one interesting part where I usually like a lot, because it's not often that we see people who are passionate about some of these diseases. So that's why I'm always very grateful and say thank you to Bebe Cool and RMD for having time to join us today. We all know that TB needs very strong political attention. And for us to have a voice, such kind of strong voice, some of the loudest voices that when they speak, people, the ears are always willing to listen. And we have these wonderful celebrities who has been supporting, helping us to be able to put the TB on the political agenda, to make sure that the political leaders actually address the issues around TB. I'm happy to have Bebe Cool, an artist and a TB champion from Uganda, one of the strong TB champions and strong TB advocates that we have in TB. He has been, not just only advocating for TB, but he also implementing TB activities in his country and also around the African region. So let me bring in Rebecca to just share some remarks on the work on, your TB in Uganda and why the issue is important to you. Thank you, Rebecca.
Thank you so much, Austin. Good afternoon. My side is afternoon. Good afternoon, everybody. My name is Bebe Cool. I'm from Uganda. I'm an artist, I'm a musician. I'm the TB ambassador for Uganda, and I work with my organization called Amber Heart Foundation. Now, I want to thank the people who came up with this community-based report. I'm not so vast with a lot of health issues and stuff. I've just started working deeply with tuberculosis for the last 1 year with my project, and I've come to understand a lot about it. As I've always said, it's very painful to see that even up to now, as we go to the challenge of COVID-19, we still register TB killing more people than COVID-19 for the past period of time and even as at the present. But it is surprising that the whole world could focus on how best to, create awareness and stop COVID-19, and yet the numbers of the deaths for COVID-19 would be registered less than the numbers of deaths for tuberculosis. What beats my mind is, how is it possible that those calculations of the deaths of the people who die of TB and children who die of TB every day are still above the ones of COVID, but the response to COVID is overwhelming and amazing. Well, that's what it is. But I hope I'm not wrong, by the way, on that. But on the ground in Uganda, after these months that I have been dealing with tuberculosis, I came up with a lot of ideas. I'm very happy that I was considered as an artist to, to be able to use my platform to push the messages of TB, to advocate, to, let people know more about tuberculosis. It is strange that most especially in Africa, you can only hear about TB and only if you're in hospital or if you are in school. And that was in my primary where they teach about the 6 killer diseases. But the actual fact is you don't get to understand that in real life, people are dying of tuberculosis. So on the other hand, there's always been an opportunity to see that there are certain people who are so loud permanently in their life, in their countries. For example, politicians and celebrities. I'm happy that there's that focus. There's something to do with politicians to engage, to tie TB onto the political scene, because the political scene never goes away. It's just like the celebrity scene. Yes, the celebrity scene, sometimes a celebrity will become unfamous and go down. But it is good during that time to have the celebrities tied to things like this. And I'm happy that I'm doing so. In my project, I have noticed that we lack awareness. Now, amongst the problems that I see that bring about the biggest issues that we are suffering from, which is, what do you call it? The word has gone out of my head. When people are sick and the others don't want to come close to them, what do you call that, Austin?
Stigma.
Stigma.
Yeah, one of the biggest problems caused by, actually the biggest problem of tuberculosis is now stigma. And one of the main fuels for stigma is lack of awareness, because this awareness actually should not be focused on the people who are sick of TB. It should be focused on the people who are not sick. It should be focused on the communities that don't have TB. The communities that don't have TB, there is no way they will stay away from stigma if they do not have any knowledge about tuberculosis. Remember, those communities have never been sick of TB, so they don't understand why you're telling them about stigma. They don't know. So our focus, I think the biggest mistake has been somewhere related to talking about stigma in the communities which have TB, which are the same communities which are suffering from TB and stigma. Instead, it should be the other way around. So that kind of awareness needs a lot of funding. That is radio adverts nearly every other time. That is TV adverts. We need, just like a normal music song, because songs are played, or DJs will play music for people who are not sick. So we need to play this for people who haven't had anything to do with TB. That's when stigma now can be addressed. Now, that's when those same communities will be aware about the dangers of TB and hence the danger of stigma. Now, to me, I have run a program of different interventions in my communities in 3 different districts. But one of the most interesting interventions that I have worked with is called the cough desk. Since about March, April, when the program had to re-begin, we had to begin in Jan and then closed end of Feb. We had to, the lockdown. And then after the lockdown, once it was being opened a bit, we restarted. But I restarted with an intervention called a cough desk. We placed cough desks on the main gates of the facilities, not inside the facility, but on the main gate of the facility. And in these few months, we've managed to screen about 350,000 people in just a few facilities in these 3 districts. Uganda has more than 40, 50 districts, but I'm operating within just 3 districts and within just two or three towns. But you can imagine, in those few months, we have I've managed to have about 4,000 suspects, and then I've been able to have 550 positives. Now, 550 positives in that period of time, I have managed to do some little research to find out how many positives did those facilities have before the cough desk in the same specific time. It would be shocking that it's about a half of it. Okay, so I think one of the best ideas that can come up in so many different facilities, because at the end of the day, if you have a cough desk on a main gate of a facility, there are so many people who go to facilities for different reasons. Some will come because they are escorting the sick. Some will come just to buy medication. For example, in the settings of Africa, like my country, Uganda, we have pharmacies in facilities. Some will come to just buy. But you see, if you keep checking each person who keeps coming, you're most likely not to miss, since one of our major issues with the TB here is finding missing patients. So I want to encourage personally as Bebe Cool in Uganda, I want to encourage more funding. I know I always talk about funding, but this time I even have more reason to get funded more. Because imagine if I'm in only about 18 facilities or 10 to 15 facilities in Uganda and I have those positives. What about if I was in about 200 facilities in my country? I would be somewhere on the targets of ending tuberculosis in my country. Because let's say in 3 years, operating in 200 facilities, testing more than, everybody who enters in the facility from January to February, then that means I would be on the journey to ending TB. And maybe also noticing that, COVID has caused a lot of issues. I like the lady who presented the report. I like the direction of saying, let's take advantage of COVID. Yes, once COVID, if we get the drugs, what do you call that? I'm an artist.
The vaccine.
Yes, if we get the vaccines, okay, that means the people will get the vaccine, and the people who have been seated in the offices fighting and making sure that COVID, they get the vaccine, can they just turn the page and remove the word called COVID, and then they just put the word called tuberculosis, so that same process just continues. That same attention just continues. The same people keep in those offices, even with quarter the budget of what they have used as a budget for COVID, a quarter of that budget would be very effective when it comes to tuberculosis. Let me not continue, because for Bebe Cool, I always talk too much because I have a lot, but thank you so much for this platform, and thank you for inviting me for this beautiful meeting.
Thank you, Bebe. Thank you so much for making the point. You made very excellent point in terms of, and I mean, your work too. Thank you for your work in terms of the numbers. The numbers that you're testing is huge. The cases that you're getting is also huge in terms of the numbers. We are so grateful in terms of your work. It's not only just about advocating, but also implementing. You're putting the work to action. Practicing what you preach. It is something that we are so grateful about. We call the suspect that we are talking about, we call them presumptive cases. When people are hiding away, we call them presumptive cases. But that is good. We are so happy with the kind of work you are doing. And please, if you have any questions, go ahead to write into the chat. We'll be responding to the questions in the chat. Before I call on RMD to launch this report, I want to say that the full report will be shared after all the regional launch. We will be happening in just a few days because we are having different languages in the report. And when I call on RMD to launch the report, after the launching of the report, we want you to open up your screen, your camera, so that we can take a picture. We see with all your faces as part of next step for the launch. That is what we'll be doing after I call on RMD to launch the report. And again, I also want to inform you that in terms of if you have any question, please go ahead and put it in the chat. I want to invite RMD, Richard Mofe-Damijo, a Nigerian big actor, you know, one of these big TV champions in Nigeria. He has joined us in several occasions, you know, and today also he's also joining us. He's been patient waiting to launch this report for us. I'm going to invite him to share, you know, just to, you know, any remark in terms of before he goes ahead to launch reports, anything you feel that you want to say about the report before you go ahead to launch the report. I want to remind you that you are my mom's biggest fan in Nigeria. Thank you.
Okay, thank you very much, Justin. I hope everybody can hear me.
We can hear you. Clearly.
Oh, okay. Yeah, thank you so much. And also want to thank Bebe Cool for his earlier remarks and his contributions in Uganda. That's a massive thing. For me, just listening to the summary of the presentation of the report, you know, the attention of government and our leaders is usually not when there is no clear and present danger to everybody. There is usually the tendency to just keep, you know, some of the most disturbing things in our lives to the back burner, which is what is happening to our TB campaign across Africa. There's a tendency, maybe because there is a cure, maybe because there is curable, the numbers don't frighten them anymore, as unlike a novel virus like COVID-19. So, you know, and linking with that, that's I had said earlier on in the chat room that for me, the takeaway from this is not to use COVID-19 the focus on COVID-19 as an excuse not to achieve some of the call to action or some of the things that we should have achieved at this moment in our fight to stop TB. Instead, it should be an opportunity to build back, not just build back, to build higher than where we were before COVID-19 struck. Again, beautiful report. I must commend the people who put the report together. And I like the fact that it's a 6-pronged call to action. And I hope that all the various countries can you know, dig in, you know, plant their heels very strongly on the ground and begin to implement some of those things. There can never be enough appeal for more funding, because a lot of chapters, a lot of NGOs, a lot of civil society that are in this fight are constantly being underfunded. I hope that 2021 brings a new spell in our fight for COVID. And again, just to cue up to what Bebe Cool said, that he cannot believe that in spite of what COVID-19 is doing, that there are more people dying from TB. Well, yes, that's just the hard the hard fact of the matter that stares us in the face. How to bring that to clear and present danger in the minds of our leaders and our parliamentarians and heads of states and presidents across Africa and across the world is another thing that we all need to advocate for and double up our efforts to do that. I've never launched a report before, but I guess this is this is a good time to say that, you know, I love how the report has been put together. I love the fact that there are strong call to action points, and we should all embrace it and go ahead and implement it. So that being said, I'd like to say that I launched the report worldwide. Thank you.
Thank you, RMD. And please keep your camera on, everyone, so that we can take a group picture. We're doing that in the background. Ricardo, James, can you help us take a group picture in the background, please? Thank you. Thank you. Thank you, RMD. Thank you once again for launching the report. We're having the regional launch in other continents as well. As I'm speaking, in a few moments, we're going to launch in the Francophone Africa as well, and also launch in the Americas and also in the Asia as well. So thank you for being the first to launch this report. we promise you that in terms of advocacy, as you push on, we also support you to make sure that your voice is actually held louder and clear out there. Thank you very much for launching the report. Let me call on Toko. Toko is also my colleague. She's a colleague board member on the Stop TB Partnership. She's the board rep for the communities delegation. She would sit with Timur on the Stop TB Partnership board. I want her to reflect on the need, our next step moving forward. Thank you. Toko, please, you have the floor.
Thank you so much, Austin, and thank you so much to all the previous speakers, and actually congratulating everyone today for this wonderful launch that we have had today, and R&D for your great remarks, and also just appreciating all the effort that has been put together in coming up with this report. Partners like Stop TB Partnership, of course, all of us on this, as 3 civil society delegation representatives on the board. It's really a pleasure to have this report coming out to inform our next actions. And just also mentioning, Austin, that I can't agree any better with the previous speakers as regards to the need for this report moving towards achieving the UN high-level meeting targets and commitments. And of course, there are a lot of sentiments that I've already made as regards to political will, which is a very crucial step as we're moving towards making sure that the report and the findings and the outcomes that come beyond the advocacy that emanates from the report are context-based, and that they indeed move towards changing the landscape within the countries. I would want to reflect on particular elements of the call to action, such as issues of human rights that are very critical as we move forward. And we have learned in the past that we still have key populations that are being left behind in terms of TB. And as we move towards addressing TB and managing TB by 2030, we should now begin to look at key populations and making sure that all of them are reached in an equitable manner, but also they are able to access quality services. And I can mention about issues of prisoners, TB in prison, minors, children. We still have a huge gap in reaching, making sure that children are able to access TB services, issues of migrants, injecting drug users, and all those key populations. And then also mentioning about the funding issue. It has already been mentioned by all the previous speakers, but I particularly want to focus on moving the conversation beyond domestic resources, but focusing on government, but as well as looking at other innovative financing mechanisms to support the deficit that we have. Indeed, we have launched the TB 33% campaign, which is something that is going to stimulate the debate around the lack of adequate funding for TB. But we should move beyond looking at government resources, but we're actually looking at other innovative financing mechanisms. And again, taking a step further, as we look at the report and the call to action, one thing that is also significant to me is an issue of efficiencies in implementing TB projects. We have seen a lot of pilferage of resources in our countries, where if we were to be able to manage the resources that we're going to mobilize through the TB 33% campaign and all the other campaigns that have been running, then we also have to put significant effort on building efficiencies, closing the tap of pilferage of resources to ensure that we reach the UN high-level meeting targets. And then that also speaks to the issue of accountability that has already been spoken about, but taking a step further as a community representative on issues of community-led monitoring. We need to put service users at the fore of ensuring that there is accountability and transparencies in TB programming. And then Olive also mentioned the issue of new tools. We have to move forward with new tools. Without new tools, indeed, we cannot change the landscape. And we have learned the issue of political will as regards to COVID-19. We saw all the heads of states in most of our African countries coming forward to speak about COVID-19 and the attention itself that came with COVID-19. if we had to leverage on that, and if we are going to leverage on that, requires a lot of concerted efforts for us to indeed build on what has already been mobilized, what has already been leveraged to impact on continued and sustainable political will on addressing health as a whole. And also just speaking about capitalizing on the universal health coverage campaign, which has already gained traction in many countries, that we also bring the issue of TB to light of the politicians' priorities. Speaking about the next step, I feel it's critical that we continue with the social mobilization. This is one step of building momentum, as well as in countries. And I want to agree with Olive when she talked about having national launches that are coordinated, but I actually feel we should move beyond the coordination to also look at a multi-sector initiative. A couple of days ago, we had the global UN agencies meeting around the same report. I feel the multi-sectoral collaboration needs to go beyond the regional level, but actually at the country level, we have UN agencies, we have government, members of parliament, and thank you so much, Honorable Moody, and the delegation that is on the call today for availing yourself at this call. It's very significant that we move this agenda beyond civil society, but to ensure that there is support of the political sector, but as well as UN agencies and technical partners in country. One last comment from me is an issue of monitoring and evaluation, that these reports now should be broken down as we move forward into country-specific monitoring and evaluation tools, frameworks, to ensure that the UN high-level meeting targets are actually contextualized at the country level, that we know what is happening at the country level, and then that is actually broken down into messaging at a country level. And then my last comment is around the TB 33% agenda, that we should take it forward, moving from now, that it's actually embedded within the outcomes of the report, particularly on issues of financing. I would want to agree with Baby Cool that without funding, there is nothing that we can do. We can do as much, but we need financing as a critical enabler to make sure that the UN high-level meeting targets are achieved. With that said, I would like to finish by thanking everyone who was on the call, and of course for giving me this opportunity to make these remarks. I turn over to you, Austin. Thank you.
Thank you, Toko. You're one of our celebrities on the call as well. Thank you, Toko. You're looking good. First of all, let me say thank you to all the panelists. Thank you to all the participants. We want to open up a little bit for the question. We want to respond to some of the questions in the chat. In the chat, I'm not seeing any real question, but I responded to Nana already in terms of the 33 TV campaign. We'll be reaching out to you. We're having some kind of consultation in the background going on, so that we will share with you quite a comprehensive campaign strategy on the 33 TB campaign. If anyone have any response, or you have, if you have any question, you can raise your hand, so that I have Solomon Ndahi, if you have any question, please go on, just 1 minute quickly. You can show by raise of hands if you have any question. We have just 5 minutes to do this quickly. Solomon, please. Thank you. Solomon Ndahi, you have your hand is raised. Do you have a question or any comment? Okay. Thank you. Any other question? Any comment? If there are no more questions or comments, let me start by telling you that we are going to go on to other. I think Mayowa has something to say. Mayowa, can you say something about the report? Also, Mayowa is also from the developing country delegation as well. Mayowa, you have the floor, please.
Okay, thank you, Chief. I just want to congratulate everyone for the successful development and launching of this wonderful report. I think the report, the issues that we are facing, especially the great divide between the realities and the commitments. And my own appeal is for every one of us, especially in country, to adopt these 6 key advocacy priorities for our countries, for the TB communities and national TB.
I'm not sure what's happening. Mayowa, are you there?
To change the narrative. So on that note, I want to say
Okay, so thank you, Mayowa. I think if I heard you right, I think you are just concluding. But I know you were saying the right things about the report. If we can't hear you, I know that the network problems are always challenging sometimes from Nigeria. So thank you, Mayowa. And
just one element. I'm just trying to give us an idea of what we're doing for.
Thank you, Mayowa, and thank you everyone for joining. Thanks to the panelists. Please, I'm inviting you to join the other regional launch. French, Francophone regional launch is happening. I know that most of you on this call also speaks French, understand French. We'll also be joining the Asia launch. So I want you to always check on the Stop TB Partnership website. And also on the Facebook, social media, other social media handles for this information. So thank you so much, participants. I don't know whether you have any message from the Stop TB Partnership.
Hi, Austin. It's James here from Stop TB. Just firstly to congratulate all the partners on the wonderful report and for this launch event. It's really great to have that level of engagement. The second thing, I note some of the questions in the chat about accessing the report. Once each of the regional launches has been completed, the report will be available in several languages and it will be disseminated to everyone who is engaged, and that will be, including through ACT, Austin, IANASA, other partners as well. So that will be something to look out for very, very shortly. And then the third point is just to note around the issue of funding. It's been fantastic that the Challenge Facility for Civil Society, which is a grant mechanism for civil society in TB, has just announced that it will triple in size next year. And as part of that, we really hope that it can be utilized to implement the 6 key action items that are called for in this report as part of the efforts that organizations submit for and then subsequently implement. But thanks so much for that opportunity, Austin.
Thank you, James. And just to also thank you again, James, for your support for making sure that this report, you personally, I know the kind of work that you did, sleepless night, making sure that you support me in the background at this report, and also to Afro Global Alliance as well, and everyone who supported in this report. Thank you so much, everyone. And we look forward to seeing you in the other regional launch as well. Thank you, everyone, and thank you. Bye. Congratulations.
Bye-bye.
Thank you. Bye.